Good morning, Malaysia.
Good afternoon, Lim.
Good afternoon, Dr. Prem. Welcome to the Lim Ren live show. Today we have the privilege of having Dr. Premadeva, who we fondly call him, but his nickname Dr. Prem. Now, Dr. Prem is a Klang boy from the great school of ACS Klang. So let us get our hands together. All the ACS boys, please give Dr. Prem a cheer.
Thanks, Lim. Thanks. Thank you for having me on your show. It's good. It's great to be here, and I can feel the positive vibes already.
So let me tell you who is this guy. Dr. Prem is from a middle-income family. The father is a TMB employee, and he is the eldest of two brothers. Dr. Prem went to Manipal Medical University to study medicine and went on to study ophthalmologist, which is eye specialist after his housemanship and serving the government. Now he is now an eye specialist with a sub-specialization into children's eye care. That is very, very interesting. Ophthalmologist, handling all the adults and older people, but a sub-specialization handling just children's eye care. A loving father of three lovely daughters, aged 16, 11, and a baby, 2 years old. You can tell us about the 2-year-old later. Married to Dr. Kogilawani, who is also a serving child cancer specialist at HKL. Now, Dr. Prem is an avid joker, a nice person to be with. And let's welcome my dear friend and my client, Dr. Prem. Yay!
Yeah, thanks again. I'm not the joker. You're the biggest joker I met so far. So it just put two jokers, and we'll be making jokes the whole day. Thanks for having me. Thanks, Lim.
Thank you for coming on, and I wish all of our listener and all of our audience can actually have a good time learning from you, basically getting information. Now, today's topic, it is about children's eye care.
Yes,
Seeing through the eyes of a child, how to take care of your child's eye and making them better, or if not worse, just maintain it. So the first question is, Doctor, now kids nowadays are wearing glasses younger and younger. Now what can we do as parents to prevent our kids from wearing glasses too young?
Right. A very, very good question, and I think it's a general public would also like not to wear glasses. But if you notice, I too am wearing glasses, but I did not wear as a child. But these days, children are wearing younger and younger. That's not because they have an eye problem early on. It's just because we are picking the eye disorder much at an earlier age. Now, child might start wearing glasses at 4 years of age or 5, and parents would say, is that too young to start wearing glasses? Now, the main reason they're wearing glasses is to correct their visual acuity, so they can see well, they can see the world well. All right, they might either be short-sighted, that means they see very well near, so their world at a distance might be blur, or they may be far-sighted, where near vision has been really compromised. So they are wearing glasses because their world needs to be clear. At school especially, alphabets are getting smaller and smaller. You don't get huge alphabets being written out, so they need to see their world clearly. And also the parents are also getting more knowledgeable. Mm-hmm. If they notice their children tend to be squinting or finding words hard to read, or they go too near the television, parents get a bit anxious and they go online. They find out what's wrong, and they go to their nearest optician or even an eye doctor, and they say, what may be wrong with my child? And the most easiest way of just examining, it's just to do a simple refraction, right? And the simple refraction may show that the child may have a large refractive error. Now, if it's a small refractive error and it's within the normal or for the child's age, it's not necessary to wear the glasses. But if child is having problems at school, difficulty in catching up with what is written on the board, then it is worth getting the child to wear the glasses, right?
So what you're saying is that now parents are getting knowledgeable, and that's why we are picking up all these children's eye reflection problem earlier.
Yes, and the child will wear the glasses or the trial frames, and they say, "Wow, I can see better," and that's the simple thing. A child who is not happy with the glasses would not wear the glasses. A child that's, there's a favorite TV show on, and he's sitting at the couch, and he'll be running, "Mommy, Daddy, where's my glasses? My favorite show is on." That simple says that the child wants to see a clearer world.
So what are the symptoms that we should look out to pick out a child with a reflection problem, a nearsighted issue? What kind of symptoms that we should pick
out? The parents, especially the mothers have this sixth sense, and they will usually notice the child bringing the book too close to read, or the TV. The child has to go near the TV before he recognizes the characters, or they tend to rub or squint the eyes, to see clearly. Mm-hmm. Those are signs that the problem. Even a simple constant rubbing before they see things clearly, or
rubbing the eye.
Yes, could be an early sign that shows that may be a refractive error. Mm-hmm. Yeah, but also listen to the intonation of the mother, and also teachers. Teachers tend to say, your child may be slow in catching up in work and is not finishing writing what is on the board as a normal kid. So they are slow in catching up in work. So it's not because the child is unable mentally to catch up, it's just they can't see well. Mm-hmm. So a simple reflection would probably help with this.
Now, so I have two young girls who actually start wearing glasses when they're 7, 8 years old. And you saw one of them, you were adjusting her glasses yesterday. So now, for kids as young as this, my question for you is this: how can we prevent them from wearing glasses? What should we do to prevent them to wear glasses too young?
Okay, there are a few habits I would say we need to stop in our modern age. One is giving the children too young handphones and iPads. There are tablets. I see parents easily just give tablets and handphone to children 4 years and below, 2 years and below, and the child is hooked on these gadgets for many hours. The constant usage of handphones and tablets, iPad, and the intensity of their viewing of these gadgets actually predisposed for them to have a higher refractive error, especially a myopic shift or nearsightedness. So a restriction would be very, very helpful. The American Academy of Ophthalmology actually suggests that children less than 4 should not have any contact with any gadgets, handphones, tablets, at all. And children less than 6 should be restricted to an hour a day, and not more than that.
You are saying children less than 4 years old, no handphone, no gadget.
Well, sometimes a bit difficult, but yes, that would be ideal, right? But if you have a 2-year-old and below, that's definite. 4-year-old, maybe just a song or two will be fine. But if a child is hooked on a near work constantly for hours, that is something that will predispose to a refractive error later on.
Can you call my mother? Can you call my mother and tell her not to give my 4-year-old son?
My 2-year child, you want to really quiet her down. You just have to put the shaka-doo-doo song on, and she'll be doing this.
Ping pong.
Yeah. So
All
that
the
quite
father
her
knows.
very quite fast, but she's not constantly on the phone,
Right.
you know.
So you're saying 4 years
And
old below, no phone, and
it is
then
advisable.
older is better. Older you
Yeah.
can give a little bit more leeway, right? So continue, please.
So
How could we prevent?
yes,
Yeah.
the other thing is not restricting outdoor work for children. Now we really do not scientifically can't prove why, but sunlight do help with a normal growth and maturation of the eyeball.
Sunlight.
So sunlight. So I'm not talking about afternoon sunlight. You can be in the morning or evening sunlight. An hour a day outdoor on an hour a day, not a week, or a cumulative 7 hours per week do help with a normal, healthy growth of the child and help reduce the refractive error of this child. So some parents who come to me and say, what can I do? And these are a few things. And when I say outdoor, it's not outside the house. I mean, I'm talking to the playing field, to the outdoors area. You know, take the child for a walk, take the child for a stroll by the hills. They are supposed to see the far objects, you know, the trees, the birds, the airplane that's flying overhead, things that are distant. We as human beings grew up as hunter-gatherers. We look things far.
Yeah.
So our vision is towards distance. But modern lifestyle and high rises limit our vision to indoors and sometimes just up to TV distance. So yeah, things have to change a bit. Yeah.
So you're saying no handphones, no tablets too young, and bring them outdoor. All right.
Outdoor sunlight,
Outdoor, sunlight.
exposure to sunlight. You don't have to get burned in the afternoon sun, but sunlight do help in normal maturation of the eyeball. Yeah.
Fantastic.
Especially in children less than 4 or 5, and that's where the eye sort of grows to the adult size by 4 years old. So don't wait until you're 8 years old to come out and play. Yes.
You're talking about your own childhood, right?
I was outdoors. Yeah, me and my brother drive my parents nuts sometimes, but we were good boys nevertheless. We were good boys nevertheless.
Same with me. I grew up basically playing from 3 to 6 o'clock in the afternoon every day. The picture of the mother having a rotan waiting for you to come back. That is very true.
Yeah,
that is
this
very
is true. I was a bit more bookworm, so my mother was rotan for me to get out. So it's different a bit. So
So your mother had to chase you out of the house. Now, can we ask you another question? Now we have seen children of having congenital eye problem like squint eyes and some heavy lenses when children need to do. Can it be corrected surgically or non-surgically? I have clients who actually have children like that, wearing glasses and squint eye and all that. So what do you do with these children?
Okay, if the child, when you say congenital, that means they're born with it.
Yes, they're born with it.
And those are the kids which large deviation or large squint. That means the eyes tend to go in a lot more than normal. And what happens if you allow this to progress is the brain sort of miswire. We use our right eye to look on the right field and left eye to left field, but because they cross eye in an X pattern, the right eye tend to see the vision or the field of the left side, and the left eye tend to see the vision on the right side. So this cross eye will progress as the child grows up, and after the age of 8 to 10 years old, it's sort of fixed and it's a bit more rigid. So it's wise to do this child early on, and sometimes we do as young as a year plus, just to make the alignment straight, and the rewiring occurs as the child grows up. So yes, this can happen. Coming back to the second part where you said they are wearing thick glasses, and these children, if you take out the glasses, the alignment actually is worse. They wear glasses to actually improve with the alignment. So I would say these are probably later on when they already have some misalignment, but not where they need to not so bad and can be corrected with just wearing glasses. And that's because glasses help improve the vision and the alignment, and the child can learn to focus better.
There's a viewer who actually asked, Moses actually asked, what actually caused a child to have lazy eyes? Is it related to what we are discussing now?
Okay, lazy eyes is when one eye is not seeing as well as the other eye. Now, structurally, could be normal. That means when you take to the eye doctor and doctor says everything seems correct. But when we try to get the child to see, the one eye will probably see the smallest letter and the other eye is about 3 or 4 lines short of that line. So this could be due to many reasons. One is refraction, refractive area. That means the power is different. Second, there might be a media problem. That means mild cataract or a neurological problem. So the most common I see is a refractive problem. And if it's mild and corrected with glasses, that is the most important part. So even after a simple cataract surgery, that means the child is unilateral cataract. When they do a surgery, the surgery is only the first part. We tell the parents. We say the main part comes after surgery, where they need to build up the strength of the vision, and that includes patching and making sure the child is wearing glasses and patch the good eye, so they exercise the lazy eyes. So a lot of factors, we really don't know why the patching, why there is a lazy eyes, but it's not the end. And for children with lazy eyes, I would say earlier the treatment, the better it is. Because if you can catch a child before the age of 4, 5, the child might grow up normal. But if you try on a child that's already about 10 years old, it's more difficult. It's not impossible, but you probably not get the same good effect.
Right. So thank you so much for that. Very clear. Lazy eyes from what do you call this? Cross eye to. That's a lot.
You're confusing me. You're confusing me now. Yeah. Sorry.
Now we heard of a wonder eye drop. There's this wonder eye drop that can stop or prevent myopia, which is nearsightedness, among children. Can you tell us more about it? What is this wonder eye drop?
Okay. I think you're talking about the atropine 0.01%.
Atropine 0.01%.
So this was had come out from Singapore, and yes, if you see the chart in green, the purple, black, blue, and green are all different concentration of the same medication, which is atropine. But what I like your viewers to concentrate here is a bit on the green line. And what it shows, it's with time, over the 6 months, for the 2 years which they did the study, it shows a slow progression in the first 24 months. The first 24 months shows there is a flattening of the shift in myopic. I'm not saying that there is a wonder drug which improves the refraction or the power of the eye, but it slows down the refraction. And it's a long term. It's not within 6 months, it's not within 1-2 years. And it slows down the rate of myopic shift. Now, if you see after 24 months, the study has actually stopped the drops. And what it shows is the progression slows down even after that, especially in the atropine drops of 0.01. Okay, so the curve you can see on the green line sort of slows down the progression. But what the curve is showing is, if you compare to the red line, if no treatment was done, right? Compare the red line, no treatment done. So this is not a wonder drug, but a study that shows that atropine does work on long term and slows down the progression. It is not a wonder drug,
So it is a drug. It is an eye drop that you must administer every day for a long term. It is not something you do for a week or 5 days or 3 days, right?
True.
So how do we get this? Where can we get this atropine 0.01% for both of my daughters? How can we?
Okay. The medicine is you need to get is a prescription medication, so you need to see a doctor, because even before prescribing, a doctor needs to examine and see whether it is appropriate for the child. While the 0.01 drop has the least effect, it's not without its side effect. So a doctor needs to monitor, and if the child is suitable, should be administered and followed up over the time period.
Okay. So follow up over a time period. So is atropine 0.1%? It is a
0.01.
0.01%. It is a prescription drug, so go and see an eye doctor. If you do not know who to see, that guy is just sitting there. So if they want to see you, Dr. Prem, where can they find you?
I'm in KPJ Rawang, but I'm happy to share with you my colleagues, esteemed colleagues who are doing pediatric ophthalmology or some of general ophthalmology that's nearest to your clients. I'm happy to share with that.
Now, if you want to see Dr. Prem, he's at KPJ Rawang. Downwards, there's this scrolling text going on. You can actually call his direct line clinic and make an appointment to see him. Now, there's one question by Jasmine Ho that I need to show you. The question is quite long. Let me just show it on the screen. Yeah, it's that long. So Jasmine was saying, Dr. Prem, my 11-year-old got his first pair of specs about 6 months ago, short-sighted at plus 50. But when we went back for a follow-up check, the optician said he is not sure during the check, and he now finds that the son is long-sighted. 6 months ago was short-sighted, now is long-sighted. The optician has asked us to visit the eye specialist as they can't determine my son's eye power. Power means we have not done so due to MCO. My question is, what could it be, and what could be the issue, and is it common among children? This kind of misdiagnosis kind of thing.
Okay. Yes, I have children that comes in, and I get confused too, because what happens is a child has a very strong accommodating power, so they can see near extremely close by, and then can see far also without much problem. So sometimes this tends to give a false impression, and in children, especially those 4 and below, or sometimes 5, I have to put some eye drops to relax their eyes. Now, Jasmine's son, I think, was 11 years old, and the power she wrote was plus 0.5.
Yeah, plus 50.
Plus 50 is way too high. I've not seen a child with plus 50. So I would say go and check the eye again. Yeah, 0.5. And if it's 0.5 and the vision is good, it's not necessary for the child to wear glasses. So again, I would ask Jasmine, what is the main problem? Why is the child complaining? What other symptoms he's having? I mean, it's headache or things like that. Or why? What is the refraction, best corrected refraction? And what's the vision without glasses? So those are the things I would consider, because not all children needs glasses, even though it's just 0.5. It's not necessary. If it's a large power, like 2 diopters difference, or even with astig of minus 2.5, I would recommend glasses. But if it's 0.75, 0.5, child is not necessarily needs the glasses.
So Jasmine, you hear the doctor says go and see a doctor. Right? So you can see him if you want to. Go and recheck. Now, let's talk about the bread and butter. Everybody have this problem thing. It's called cataract. Everyone must do this once a lifetime if you live long enough. That is from an eye doctor who told me that. You have to do it once a lifetime if you live long enough. So at what age should we get our eyes checked for cataract?
I was about to say, Lim, that I'm sure Tun Mahathir has his cataract done because he's lived long enough.
You can have 2 sets done.
Okay, cataract, it's a normal aging process. So most people start having a bit of blurry vision once they hit about 50, 60, and after 60, 65, vision tends to get a bit more difficult. Again, it depends, what's your age and what's the problem, but cataract can occur at any time of age. It can occur in children, but very rare. But most of the time, it is an age or senile aging factor. So mostly after 65, you will have some form of cataract. But if vision is not disturbing, then it should not be a problem. Now, vision, when I'm saying vision is disturbing, is you can't do your normal activity like going to the park, walking. You have problem reading. You don't recognize people distance, or even nighttime driving becomes difficult. Those, if you have all four, then it's best to get an eye checkup. And if you're above 60, 65, it's time to check whether you need to have something done, or just a simple glasses will be done sufficient. But vision disturbance can occur usually after the age of 60, 65.
So now the golden question is, cataract surgery can be cheap, can be expensive. Multifocal, monofocal, they are priced different. Now some insurance company doesn't pay the full price. What do you recommend? Monofocal, or should we go for the expensive ones, the multifocal and the hyper HD? I've heard of a hyper HD multifocal cataract lens. So what should we do as consumer? Can you tell us about it? So what is cataract surgery?
All right. Cataract surgery occurs when the lens becomes opacified. Yeah, you have it online. Lens becomes opacified, and what happens is we need to remove that opacification that's occurring on the lens and replace with a clear lens, and that will help make the world seems clearer. Right? What the picture is showing is a simple cataract surgery, the modern cataract surgery, in which we use as phacoemulsification through a small wound, which is about 2.75 or smaller, and implant a foldable lens, which will remain in the bag, where what was once your clear natural lens. But with age, that needs to be replaced. So yeah, a modern surgery is a very straightforward surgery, and it's one of the most commonly done surgery in the world. It has its own risk factor, right? But it's one of the lowest in the current modern surgery. So, but if the eye has its own problems, like it had a trauma or injury or things like that, then it doesn't become a straightforward surgery. It becomes more about a complex cataract surgery. So you need to see the doctor. An eye assessment needs to be done. What are the risk factors? What is the benefit? That needs to be discussed with your doctor.
So now, multifocal or monofocal, tell us.
Right. So 20 years ago, when lens was very simple, you only had a monofocal. And what happens with monofocal is it corrects vision at a distance. So if you are driving, you need to see a distance, and the plane, the mountains, the trees from the distance, it appears clear. But when it comes to reading, things becomes a bit more difficult, and you need a spectacle, a plus at spectacle to improve the vision for near, especially reading. And so a lot of the lens company has gone and invested, and they have come out with this, what we call monofocal or continuous vision or things like that, in which you do not need glasses for reading, right? So you can have good vision for distance, intermediate, and near. And that, because lens company has invested lots of money, it's been priced as premium lens. So it's like cars. You have, your premium Bentley, and then you have your Toyota Camaris, or your Honda Accords and things like that. So lens very much depends on what is the person's lifestyle. All right? And therefore, you need to discuss with your doctor what is your preference, and also budget. We have to tell, but I love to have a Ferrari in my drive-through garage, but I can't afford it. So, I look at my income and I need to balance and budget a car. So same thing for an operation. For most surgeons who do cataract surgery, their rates are fixed. You are paying additional is for the lenses, and multifocal can go up to 4,000 or 5,000 a piece. However, and I say this with precautions for all your future clients and current clients, is always ask the risks and benefit. What are the limitations of the lens? Not all expensive lens has the best results, because multifocals has its limitation. You need good lighting for reading. You can't have dim lighting, and there is restriction for driving at nights, because these lenses have problems with glare and halo. So
what is glare and halo?
So when you drive at nights and you see the back lights, or
this one,
and you see the lights or the street lights, they tend to have this circular or distorted light. They are not sharp. So halos and glares can be mild, moderate, or severe. And you can see on the severe side, it is very, very difficult to drive at night if you're going to have that type of vision. And I myself had a client, a patient who came and wanted the most expensive lens. I was happy to and explain the risks and benefit and things like that. And what he didn't tell me was he was a biker, and 2 months after surgery, a successful surgery, his vision was good. He's happy with reading in my clinic, good lighting and all. But he was very disturbed about bringing out his bike in the evenings and nights, because he says he was not feeling safe to bring his vehicle out, and that's because of the glare and halos. So a lot of things need to be discussed with the patients before they implant their expensive lens or premium lens.
So, Dr. Prem, for one thing I noticed, you spend time talking to your patients quite a lot. Can you tell us more about that?
Well, I actually hope that all my patients that leave, especially from the first examination. The first examination, I need to spend time, because the patient needs to understand their disease process. What's wrong with their eyes? Why is it like that? What can they do, and how can I help make them better? So if a patient comes in and goes out without understanding their eye problem, I feel I have not done my job. So you need to spend time, and you need to answer as many of their doubts and questions, so they go out understanding or have a concept of what's wrong with their eyes. Now, you have come and seen me and waited a few hours sometimes to see me. I don't have that many patients, as you can see, but I do spend time with my patients, because especially the first timers, because they need to understand what's going on. I mean, it's not only my patients, but the family members. A week ago, I think, husband and wife came. The patient was the husband, but the wife had this look on her face, and she wanted me something to ask. She had a question to ask, and after explaining everything to the husband and his problem, satisfied his as the patient itself, I turned and asked her what had she have any questions on for me, and she had quickly, with open eyes, "Thank you, doctor, for letting me speak." And she said, "Can you tell me the difference between a cataract and a glaucoma?" Apparently, she went somewhere for an eye screening, and the doctor told her, she may be having a glaucoma and she may be having a cataract, and she had no one to ask. So I need to spend the next 20 minutes explaining to my patient's wife what is the difference and why she was suspected to have that problem.
Good on you, doctor. Good on you. For one thing, of all my friends and all my doctors' friends and all that, this group of doctors actually spend a lot of time listening to their patient. A doctor that listens is a doctor that cares. I totally
Yeah,
agree.
you see how big the ears are. You see how the big. That's how much we listen. So
Yeah.
you need to see how big the ears are.
Yeah, thank you so much. You have given a lot of work. So one final question okay, before I go to the last question, Kenneth Tan of KK, say hi. Let me show.
Ah!
Kenneth Tan of KK, greeting from RC Rotary Club of Loyan, from Kota Kinabalu, Malaysia. All your buddies are watching you. Okay,
Yes.
so one last question. Miss Puiling asks, can astigmatism be cured? What is astigmatism?
Astigmatism. Okay. Astigmatism basically is where the vertical and horizontal plane of the light hitting the eye does not meet at the same point. So imagine if you're looking at a coconut tree leaves and you have a high astigmatism. It appears like you're looking at a banana tree. Everything seems to merge and it becomes like one leaf. So people with high astigmatism without correction, they tend to see the A, E, O, U, small alphabets A, E, O, U as similar. And number 6908 all looks round, similar pattern. So it depends. If it's a child, and let's say the child is constantly rubbing the eye and the child has allergic conjunctivitis, and you treat the allergic conjunctivitis, the astig will reduce with time. But for that moment, the child will require astigmatism correction on the glasses. If an adult, most of the time you need a correction. You either wear glasses or you get a toric contact lens, or if it's really disturbing and you can't do much, then you have other surgical options like LASIK or and other associated surgical procedures.
Right. Thank you so much for answering all these questions. And our time is coming up. But now, one last question, Doctor. Now, when you are working in a government hospital and all that, do you take up insurance with you during that time when you are still in the government hospital?
When I was in the government many years back, I did take insurance. It was not a medical card, but more of education, life insurance for future. I mean, yes, I took it quite early on, and it was a sort of a savings. Somewhere to save on. Yeah, it was something to save on, and it's a progressive thing. So I was not good in business. I was not good in investing in shares and things like that. And something that's reliable and safe would be insurance, I guess.
Right. That's good. That's good. A good way. So tomorrow at 3 p.m., I will be doing a special session of a discussion on a topic: why government medical doctors should consider taking up a private medical insurance. Now, Dr. Prem, you have a private medical insurance, I believe. And tomorrow I'll be discussing on what kind of free COVID-19 medical coverage that the insurance company now is offering. Do you know that? Insurance company is offering free COVID-19 coverage for all medical frontliners. But the surprising part is that not many doctors knows about it.
I think it's by AIA, I think, yes.
Yeah. My company is offering a certain amount of money to given to all COVID frontliners and medical frontliners. So I will have this in-depth explanation on this topic and explain the reasons, the do's and the don'ts when you decide to take up a private medical insurance. So if all the medical doctors outside, if you're interested at this topic, stay tuned with us, 3 o'clock Sunday, tomorrow afternoon. Now, thank you so much, Dr. Prem, for coming on to the show. I really have to say thank you for coming up. You've been great. You've been a great sport. Where do you find us? Where do we find you? KPJ Kajang. Sorry. KPJ Rawang.
The wife is in Kajang, okay? The wife is in Kajang.
Yeah, my wife is in Kajang. My wife is a medical doctor. She serves in Kajang Hospital. KPJ Rawang, if you need a eye doctor, if you need a eye, what do you call this, treatment or consultation, please call the number at 03-8099. Can you finish up for me? 8099?
8073.
8073. Yeah. It's coming up. You know, the thing is
807.
coming up.
I can remember 8073.
6099.
8873, sorry.
8873. 6099-8873 for an appointment with Dr. Prem. All right? So, let me tell you what is happening next week. Next week we have a guest. Next week's guest is a renowned stockbroker, Mr. Bob Tan. He is a well-known stockbroker in KL and has served the markets, some of the biggest names in the market. Now, a prolific fundraiser and also an investment manager who saw the ups and downs of 4 financial crises and still made it big today. Now, he will come on our show and share his experience on navigating through this financial crisis with the right mindset. Until next week, same time, Saturday, 3 p.m. Tomorrow, I'll have a show on the insurance coverage for medical doctors. So next week will be Bob Tan, the prolific stockbroker. Comes back to you, Dr. Prem. Thank you so much for coming up. And that is our show. Thank you. Anything you want to say before we end?
Well, if any of your clients have any questions, send them to you and then you will get back to me, all right?
Okay. Any of you needs to see Dr. Prem, you can go through me or can go direct, no problem. We have no problem with that, all right? So thank you so much for coming on,
Thanks
Dr.
again
Prem.
for having me on. Thanks for having me on.
I'll see you again hopefully next week for lunch. All right? Thank you. Bye.